And now we will have Heidi Jenkins from the STD, the program director for the STD-TB program at the Department of Public Health, give us a little bit more of a picture around other sexually transmitted infections that are affecting men who have sex with men.
Good morning, everybody. For those of you that have heard me speak before, you know this really comes from the heart when I say what an honor it is to be at an HIV conference talking about other STDs. It truly is a pleasure to be here today. It's very important what's happening with syphilis in Connecticut, and I'm going to take a minute at the end to mention a little bit about gonorrhea also. It was interesting. Now we're at through the first decade of the 2000 to 2009 era, and I thought it was a perfect time to look at what's happened with syphilis. I can sit and tell you the stories, but to look at the data really brings up a whole different picture on what we're seeing. Looking at primary and secondary syphilis, if you've heard the talking about it, primary and secondary syphilis are the two infectious stages of syphilis, and it's where we focus our efforts in doing our epidemiological interventions with clients who are infected. So looking at primary and secondary syphilis among MSM and others, so our total cases reported, you see from 2000 to 2009, the greatest increases happened among MSMs. There's very few cases reported among any other heterosexual or females. 97% of all the cases reported over these 10 years are among males. And the increase, again, happening in the MSM community as opposed to other populations. The increase, if you look at 2000, there were 12 cases of infectious syphilis reported, and in 2009 there were 65. That's an increase in over 300% between 2000 to 2009. Putting it in another perspective, in 1995, 2% of all our syphilis cases were reported among MSM. So of the MSM, what's the proportion that are infected with HIV? So this graph here gives you the different, over the years of the cases that we have had reported among MSM, the percentage that were diagnosed as HIV positive. Over the 10 years of syphilis in Connecticut, 41% of all the cases reported for primary and secondary syphilis are co-infected with HIV. By age group, it's really been difficult for us with age groups because one year it's a younger population, the next year it's the 40 plus. It varies. There's no real trends that we can have when we want to focus our interventions on a particular age group. It's been very difficult for us, and you can see that from this with the bars just up and down by age groups. Race ethnicity, this is a disease that tends to be among white males. We have seen some increases in African American and Hispanic, but again, is that a trend? Difficult to say because the numbers go up and down, but it's been pretty consistent among white males over this epidemic since 2000. So looking at the numbers of this, primary and secondary syphilis from 2000 to 2009, 80% of the cases reported were among MSM. We use this classification when we interview someone with syphilis, and the question is, when's the last time you had sex with a man? If they admit having sex with a man, they are considered an MSM. They may be married, they may be leading their heterosexual life, but they're classified as an MSM. Of those, 311 men, 41%, as I mentioned, were also diagnosed with HIV. We had 9% of these infections diagnosed more than once since 2000, which means interventions are not happening from our staff when we try and talk about risk reduction. If they're in HIV care, the interventions are not happening either because these individuals are continuing to practice high-risk behaviors and become reinfected again. STDs are a real good marker for recent unprotected sex, recent transmission of STDs and HIV potentially, so it really lets us know what's happening in the current when somebody's diagnosed with an STD. So looking at all early syphilis, this would be primary, secondary, early, latent, anyone who's been diagnosed as having syphilis for less than a year. In Connecticut, 29% were diagnosed with HIV at the time they were diagnosed with syphilis, and 71% had previously been infected with HIV when they were infected with syphilis. So when we interview them, we find out, have you been HIV tested? 71% were diagnosed with HIV prior to the syphilis diagnosis. 50% of MSMs are in their 30s and 40s. We tend to find this 30 plus. Again, in a given year, you might have some younger populations, but we tend to find 30 plus that are infected with primary and secondary syphilis. 26% of all the cases were among African Americans, 17% among Hispanics, and you, I'm sure, all know the population percentages of these African American and Hispanics in Connecticut. So what are the risk factors that we're finding? They meet sex partners on the internet. Huge, huge. We've been told I can have a man at my door quicker than a pizza when I meet him on the internet. Multiple partners. These are individuals that are having sex with many different partners during the time that they could be infected with syphilis. And on top of that, the multiple internet partners, anonymous partners. Earlier in the epidemic of this in the 2000s, the big place to go to was the Megaplex in Providence, Rhode Island. We were getting all these people going there and having sex at the Megaplex, and now it's turned into adult bookstores. We're not getting people going to the Megaplex anymore. Adult bookstores in Connecticut is the hot spot for people to go and have anonymous sex with multiple partners. Primary and secondary syphilis, as I mentioned, is the highest priority for our epidemiological follow-up. We are not very successful with our epidemiological follow-up. Also, partner notification services, one and the same. From 2005 to 2009, which is when we began collecting this data, 168 of 219 MSMs with syphilis were interviewed. We interviewed 77%. So we're missing a quarter of the interviews because these guys don't want to talk to us. They don't like the state. They don't like us. They want nothing to do with us. Go away and never speak to me again. So we're not having a lot of cooperation out there. So when we talk to them, we'll say, during the time you had syphilis, how many partners, whether you knew who they were or not, how many partners do you think you had sex with? These 168 men admitted sex with over 1,000 partners. Of those 1,000 partners, we were able to initiate to try and contact 171. Less than 20% of those named were we able to contact to attempt to get them in for testing and treatment. We found 37%. Located and treated. And of those 64, 19 were infected with syphilis. So you're seeing these numbers. 30% of what we're able to find are infected with syphilis. What about those 900 other people that we didn't find? Who knows what's going on with that? And we found that there were 32 infections that were previously treated. So these were people that were named as contacts to syphilis that had already been treated for syphilis, meaning to us that potentially those previously treated never told us about this partner that we're now sitting here talking to who's infected with syphilis. That is it for my slideshow with that. The one other thing I want to mention, we're also doing some work with gonorrhea because there is very recent transmission when you talk about gonorrhea. Syphilis could be within the last year. But we have recently done a match on data from our gonorrhea database with the HIV surveillance database to match gonorrhea cases with HIV co-infection. And we have found it from a 4-year period, I think it was 2005 to 2008, there were 10,000 cases of gonorrhea reported, and we found 145 people infected with gonorrhea who were infected with HIV. So of those, 116 matched once, 11 matched twice, 1 matched 3 times, and 1 matched 4 times. There's some really, really high-risk behavior going on out there. It's not the whole population. There is a small group that's practicing some very high-risk behavior. 78% of these cases were male, about half were African American, about half were MSM, and 62% received their gonorrhea diagnosis after they were infected with HIV. About half the cases from Hartford, Bridgeport, and New Haven, and that's similar to what we're seeing with our syphilis cases. We can't be pointing fingers at Hartford, Bridgeport, and New Haven anymore. And any given year, we have cases reported from probably 30 different towns. So those towns where people are saying, nobody has sex in my town, they are having sex in their town. So thank you very much.